Good afternoon, everyone, and thank you for joining us today. In the Legislative Building in Regina, we have Premier Scott Moe and Dr. Saqib Shahab. Joining us on the line from Saskatoon is SHA CEO Scott Livingstone. Both the Premier and Dr. Shahab will have opening remarks, followed by time for questions.
Well, thank you, everyone, for joining us today. First, I would like to offer my condolences to two families that have lost a loved one over the course of the last 24 hours. Recently, Saskatchewan, as well as provinces across Canada and jurisdictions around the world, have been facing surges in their COVID-19 cases, our collective COVID-19 cases. And we've been dealing with the challenges of community transmission and healthcare capacity issues right up to and including close to home. It has been a difficult few weeks, and let's be honest, it's been a difficult few months. Months of rules, months of guidelines, restrictions, measures, and reminders from myself, from Dr. Shahab, as well as others. Months of sacrifice by each and every person in this province. And I think it's safe to say that we're all tired of this. We're all ready for this to be over. In true Saskatchewan fashion, throughout our response to COVID-19, each of you have stepped up. You've responded to the challenge that we have all faced, and you've done so together. So today, as we approach the Christmas season and the end of the calendar year 2020, and with the promise of a vaccine on the horizon, I'm asking everyone, we have a few more miles to travel, and we need to see this through together. Throughout these last few weeks, with the sound guidance of Dr. Shahab, we've announced a series of measures to assist in slowing the increase of COVID-19 cases and thereby protecting Saskatchewan people from the virus. As many are aware, Dr. Shahab and his team have been actively monitoring our cases and our transmission rates, as well as how those are affecting the measures, or how our measures are affecting those relevant case numbers. And we've seen some positive indicators that those measures are having an impact. But there's still some more work for us to do. We need to stabilize our case numbers even further. We need to protect the capacity that we have in our healthcare system, and we need to protect our communities and our families most vulnerable. We know that much of the community transmission continues to occur in our household settings, and as a result, this needs to be a different kind of Christmas. This needs to be a very different holiday season for each of us. It needs to be a quieter Christmas. So today we are announcing that all of the public health measures that were previously announced, as well as some new ones that we are announcing today, will remain in effect until January the 15th. At that time, they will be reviewed by the Chief Medical Health Officer, and they will again either be revised, relaxed, or renewed. Effective December the 17th, private indoor gatherings will be limited to immediate household members only. Single individuals are permitted to meet with one consistent household of less than 5 individuals for the duration of this order. There are exceptions for co-parenting arrangements as they are permitted to continue, as well as caregivers and support services in the home are also permitted to continue. Outdoor gatherings can be up to 10 people only. This is a reduction from 30. Provided that physical distancing between households can be maintained at such gatherings. Effective December the 19th, we are asking casinos and bingo halls to close. Personal services may operate at 50% capacity, that's of their fire code capacity. This includes hairdressers, barbers, massage therapy, acupuncture, tattooing, and others. The gathering limit of 30 people for event venues, such as arenas, museums, theaters, and places of worship, remains the same as it has been. Effective on December the 25th, retail services must reduce their capacity. This includes customers and staff to 50%. Large retail locations are required to further limit their capacity, their customers and their staff, to 25% of their capacity. Large retail locations are defined as retailers that have a square footage that is larger than 20,000 square feet. As you know, our government recently reactivated the Saskatchewan Small Business Emergency Payment Program that we had put in place to support small businesses in this province. This program provides a payment of up to $5,000 to small and medium-sized businesses that are required to either shut down or to significantly curtail their operations due to a public health order that may be in place. And we understand that today's announcement may impact a number of additional small businesses. So those businesses may now, if required, and if they qualify, be able to collect the small business emergency payment. Subject, of course, to meeting all of the other program criteria that is there. Almost everything about this year has been different. And it's going to end with a very different kind of Christmas and holiday season for all of us. Normally, the Christmas season is a time where we all look forward to a break from our work, a chance for us to slow down, and most importantly, a chance for us to visit with some family that maybe we haven't seen for a while. The world always does slow down just a little bit over Christmas and the holiday season, and I know this is going to be different and it's going to be very challenging for many of us. But this needs to be a much quieter Christmas. And this year, we're asking each and every one of you to do just that. Let's just slow this down. Let's take advantage of the quiet time that we have ahead of us. Work from home if you're able. Don't travel if you don't need to. And enjoy some of the awesome outdoor winter activities that your community and this great province have to offer. Enjoy some time with your immediate family. Stay connected with your extended family. Stay connected with your friends. And stay connected with those people that are important in your life. And most importantly, each of us, let's keep the finish line in our sights. If we all work together, we will be able to manage the challenges of COVID-19 over the course of the next number of weeks. Yes, 2020 has been a very difficult year for all of us, but with vaccines on the way, literally, we have every reason to believe that 2021 is going to be so much better. Friends, the finish line to COVID-19 is in sight, but we do have a few more miles to travel. So let's stay safe, let's keep protecting ourselves, and let's keep protecting those around us. And we will all reach this finish line together. Dr. Shahab.
Thank you, Premier. So I'll maybe go over some key messages. I'll show a few slides and update on the epidemiology and modeling, and then close off with some of the new measures. So, as the Premier said, our case numbers are currently still hovering between that 250, 300 mark. They're not going up as much as some of the earlier models predicted. The impact of the orders on 27th November are having an effect, but they are also not going down as quickly as we would like to see them. So, the extension of the existing orders and some further measures allow many of our activities leading to the holiday season to continue. They allow us to, choose to, order takeout or safely go to a restaurant, ideally with our close household members, and sit at a table of 4. They allow us to shop for the holiday season, shop locally, use a gym with all the guidelines in place. And then over the holidays, I think, as the Premier mentioned, we really have to be very cautious because, as we'll see in the slides, while we're not seeing many of the outbreaks that are happening in October and early November, we are still seeing significant transmission in the household settings and in the in-between places, colleagues, co-workers who maybe sit closer together than they should over lunch break, or maybe meet up after work. And aren't practicing physical distancing, maybe sharing a meal or a meeting over a meal, and not in a structured environment. So I think we really need to focus on where the transmission is happening, which is mostly in those household settings, or when people are meeting and greeting each other, things that are natural for us all the time, and especially over the holidays. But at this time, unfortunately, they are leading to our ongoing transmission. And of course, the tremendous tragedy that we're seeing in a long-term care facilities. It is devastating for, obviously, residents who are unwell, who have passed away. It is devastating for their families. It is devastating for, the care staff, who in many cases are family and themselves are facing illness as well. So I think These are all factors that require us to be especially vigilant over the holiday season and continue to work towards reducing our case numbers. It's good that they're plateauing, but I think we really need to see them going down. So this just shows there are total and active cases, and we are seeing a bit of a decline in the active cases, and some of that is due to closure of case files. But it is something that is somewhat reassuring, but certainly our overall trends are still not showing a consistent downward trend. And if we look at our transmission settings, obviously there's a large number that are pending. And this is for the week of December 6th to 13th. 911 are pending investigation. For 406, no specific source of exposure can be identified, and that's become more and more common, as we don't see more outbreaks. But the investigation suggests that they're more likely in those, social contacts. They may not always be in the household, but maybe, during break time at work, or just interacting with friends and family and colleagues. So again, some cautions around how we interact. But thankfully, we aren't seeing those large outbreaks, those super spreader events, due to the measures that are currently in place. And this just provides a summary of the outbreaks October to December 13th. And this just shows that a lot of the outbreaks were in settings where either they're continuing with reduced attendees, for example, place of worship, only 30 people. For most, it's, the recommendation is participate virtually. Some changes to gathering limits for, funerals and weddings, only 30 without any food service. So all these are having an impact. We have seen over the last, 2.5 months of large outbreaks linked to, gatherings as well, large gatherings. And of course, the outbreaks in team sports, again, currently are not happening. So I think we will have to think in January, how can, if our numbers allow, how can team sports start in a way that is safer than what is happening in October, November. And then, a lot of the outbreaks in workplaces, happen, again, not because people are shopping there. They happen among co-workers because, during break times. And it's only natural. I think we should not point fingers. We all tend to, interact with our colleagues at work, outside of work. And that's where, sharing a meal, sitting closer together during break, I think that's where a lot of the transmission is happening. So again, we just need to be very thoughtful about maintaining that physical distance while remaining connected. This is a graph that has been made by the modeling group. And I think this is from data that's publicly available. I think there's a map that we sometimes show. And what this does show is that, we've had a lot of questions about why are some of the measures different from other provinces. And what this shows is that, it shows all the points in Saskatchewan where we introduce public health measures, as well as, the points where measures are introduced in other provinces. And while we obviously watch very closely what other provinces are doing, each of us has to act on where they are seeing transmission. We really can't just follow another province blindly. We have to understand where is transmission happening in our setting and take appropriate measures. And again, obviously we all receive lots of emails and commentary from both sides. Some people say you're not doing enough. Some people say you're doing too much. But we have to balance the measures so that we keep our case numbers low. We see a declining trend, but we minimize the impact on people in terms of their day-to-day lives at home, at work. And so, the measures sometimes seem severe to some, not enough to others. I think for the holidays, they are significant. Like, it is an impossible thing to say you can't meet your close friends and family over the holidays. But I think what I would like to say here is that we have to reimagine the holidays, just like we did over Easter. We need to stick to our households for the most part, but remain connected, through other means. It is that close social contact indoors that is generating a lot of the transmission. We've seen over the last 3 or 4 weeks, a simple game of cards among people who are not in the same household has caused a significant outbreak. Simple interactions in the home setting continue to cause transmission. So I think we need to, remain connected virtually We can meet others outdoors, even though the weather may not be as mild as it was a couple of weeks ago. We do embrace winter, and it's safe to be outside, greet people outdoors while maintaining the physical distance, going for a walk. But, maintaining that distance, not sharing a meal even outdoors, like in a barbecue setting, not passing things back and forth, maintaining that physical distance, but going for a walk is safer. So I think it is important to reimagine Christmas this year and the new year, and maintain, our interactions to our own households for the most part, with some exceptions. Obviously, if you live alone, you can connect with one household. Co-parenting arrangements can continue. If there's arrangements for elder care or child care, they can continue. But I think we have to be quite cautious over this holiday season. Our numbers don't allow us to interact more than we would have liked to at this point. And then, of course, over January, we'll have to see how things continue in terms of, can we maintain these current measures? Do they have to be modified even further? Or can, at some time, our numbers go to a level at which they can be loosened? Thank you.
Thank you, Premier. Thank you, Doctor. We'll now take questions. We'll take a first question from the room. Arthur?
This is for the Premier. This press conference feels very different from, say, the speech that Brian Pallister delivered when he was asking people to give up Christmas. And I'm just wondering, for the Premier, whether you take ownership for this decision as yours primarily, and what it's like for you to be calling on Saskatchewan people to make this tremendous sacrifice over the holidays.
Well, this is a similar sacrifice that not just the people of Saskatchewan are being asked to make, but it's a sacrifice that many Canadians are also being asked to make. And we're asking it of ourselves. Myself, Dr. Shahab, we have families as well. And our Christmases are going to be as different as anyone else's. Every elected member, regardless of which side of the House they sit on, their Christmases are going to be very different than last year's Christmas, and I would anticipate very different than next year's Christmas as well. With respect to taking ownership for what is occurring here today and what we're announcing here today, I would say this is on all of us across, and it isn't that we have done this to ourselves. This is a virus that we have faced, and we have faced together across this province. I'm the leader of the province. We're taking the best medical health advice that we have in Dr. Shahab, and I'm very proud of the advice, and I'm pleased with the advice that he has always provided. Myself, provided the government of Saskatchewan through the Minister of Health, and provided to the people of the province. And I think by and large, by comparison, not only to other provinces, but other areas of North America and the world, Saskatchewan has fared well. That's despite we have had recent surges in our numbers, like many other areas have, recent surges that are causing some more difficult discussion here today, specifically around spending Christmas with your own household. But we have fared quite well here in the province. So it is the government, along with Dr. Shahab, that have been bringing forward this advice as we navigate through this COVID-19 pandemic. It's the government that is enacting these decisions on Dr. Shahab's advice. It's the people of the province that have done, in my opinion, so very, very well, and I'm proud of the vast majority of them, for sure, virtually each and every person in the province, because by and large we have been adhering to the advice that is there, and I would just ask them to once again give this some serious thought going into Christmas. The advice is, continues to be here. It's a little bit of Buckley's. It doesn't taste very good, but it is absolutely necessary for us to preserve the capacity we have in our healthcare system. It's absolutely necessary for us to preserve the economic activity, the jobs that we currently have in our communities, but also the opportunity for us to recover and to build back to not only where we were pre-COVID, but better and larger. I firmly believe that we can be more ambitious with our plans as we find ourselves on the backside of this virus, and we are very close to that with the first shipment of vaccines arriving midweek this week. But this is a bitter pill. It's a bitter pill for us as individuals, for myself as individuals. I know it's a bitter pill for Saskatchewan people and Saskatchewan families. I was hopeful. I was hopeful that we were going to reduce the curve even more reduce the rate of infection even more than we have. We haven't been able to do that, and so it's very similar from a household gathering perspective. We're in a very similar situation as we have been since November the 27th. That's unfortunate for us to want to celebrate on a little larger, from a little larger perspective when the holidays hit. It's really unfortunate for those that want to visit someone in a long-term care home, and my heart pours out to those families. And I would just ask everyone to hold on to this just a little longer. Reach out virtually, through the telephone, whatever measures you have, to those that you are not able to see physically this Christmas. Please stay in touch with those that are important to you and your family.
Follow up, Arthur?
I think there's still a lot of people that feel like the existing measures are not even being very stringently enforced. Like, they think about the rally that I know that you criticized, where only 2 people were given tickets out of the several hundred that were there. Why didn't you bring forward any new enforcement measures today and what do you have to say to those who continue to defy these measures?
Well, there's been numerous breaches of the public health orders that have been in place for some time. The laws have been there since day one, and they continue to be there. And I would just say the laws that we have in place, whether it be from a personal or a corporate fine standpoint, have some of the strongest fines in the nation. And they have been administered at the discretion of the enforcement entities that are faced with enforcing the laws that are there. There was some fines that were administered this weekend. There has been in other weekends, and I don't believe in Regina, but in some other cities across the province, been some fairly severe fines that have been administered through public health to a number on the corporate side as well as the personal side. If I think back to a gospel service in Prince Albert, or some of the nightclubs that were operating, as well as some personal home gatherings that are there. But listen, I think the broader conversation that we need to continue to have, in particular as we enter into the holiday season, is there is no province, including Saskatchewan, there's no jurisdiction or region in this world that is going to enforce their way to success with COVID-19. People in this province and anywhere else in the world need to comply with the public health orders that are in place for the very reason that they're put in place, and that is to protect the most vulnerable among us, whether that be the most vulnerable in our communities, whether that be the most vulnerable in our families. Dr. Shahab had placed the data here. We have large degrees of outbreaks and cases that are coming out of our healthcare sector. We have a large number of outbreaks in our long-term care homes. This is a time for us all to pay attention to that, understand what the consequences are when COVID gets into areas like our long-term care centers. They're not good consequences. It's not good outcomes. And if you aren't going to follow the public health orders for yourself, I would ask you to think of your loved ones that may be in a long-term care center, or somebody that you know will most certainly have loved ones in there, and consider following the public health orders for their sake. They do work, but they only work when we all follow them. We aren't going to enforce our way through this. We're going to have success because people choose to comply with the orders that are put forward.
We'll take our next question from the room. Staff?
To the Premier, why didn't your slowdown work?
I think that, in fairness, the slowdown has been successful. We have stopped the rate of growth. If you looked at Dr. Shahab's graphs that he had put out, the rate of growth has been plateaued. In fact, today, I believe if I'm not mistaken, our active case count on the 7-day roll, or sorry, not our active case count, but our 7-day rolling average on the daily case counts is the lowest that it's been since November the 28th. I'm understanding that the measures that we had put in place were on November the 27th. I think it's fair to say that the measures that were put in place are working. Where we are today versus if you compare it to where the modeling said we could be today are two very different numbers. So the measures that we put in place have worked. We have plateaued and stopped, for the most part, the rate of increase of COVID-19 infections that we have. What we are doing today now is some minor adjustments to those to the November 27th measures to start to push those numbers even lower.
Follow-up, Steph?
Yeah, with respect, sir, these are not minor adjustments. Dr. Shahab called them significant, so I think some people might take issue with calling them minor. As well, the goal, I understand, a couple weeks ago was to allow people to gather at Christmas, and you actually said if people wanted to gather at Christmas, they should. This is an incentive. So it doesn't, and the fact that we're here today seems to say that the slowdown didn't work enough, and that's why you have to bring in these further, more significant measures. So again, why didn't your slowdown work or bend the curve more significantly as you would have hoped it would have?
So the hope was that we would be able to gather for Christmas, and which is why we brought in some significant measures on November the 27th. And you're right, today are more significant measures. In particular, if you're an individual that's working at a casino, for example, where you're likely going to take a break from your work for some period of time. So most certainly these are significant measures, in particular for those that they impact with respect to their jobs. The measures that we brought in on November 27th are effective. One can argue whether they're effective enough or how effective they are, but they are effective. Most certainly they're effective when you compare where we are today in stopping the rate of increase of COVID-19 infections here in the province to where the modeling said we could be if we had not made the moves that we did on November the 27th. So I think the measures have been successful, and but we do need to push our numbers down even more. We still do have some hospitalizations. We still do have a number of people that are in our intensive care units as well. And we need to push those numbers down even more so that we ultimately can find our way to the time when we can have enough people in our communities vaccinated that we can start to look at having a very different conversation, one where we can start to lift some of these measures.
We'll take our next question on the phone line.
We have Murray Mandrake with Leader Post.
Good afternoon, sir. You used the term beyond contempt to describe the comments made in front of the building in relation to Dr. Shahab. There are many people who agree, but they're obviously agree, but they think you should have used much stronger language, not only in relation to the comments related to Dr. Shahab, but in relation to this particular group flaunting mask orders, flaunting gathering orders. Many people are accusing you of not doing this for political reasons. Can you just explain to the public your choice of messaging and what messages you'd like to deliver on both the words that we're hearing from the Freedom Rally group in relation to the comments and their flaunting of mask orders and flaunting of gathering orders?
So on the flaunting of orders, public health orders that are there, I think I spoke to that before. The inconveniences that we are asking people to perform are minor with respect to the huge inconveniences ultimately that many families are dealing with a loved one that may be elderly, may be immunocompromised, that is struggling with COVID, and ultimately may end all too often 91 times thus far with the death of a family member. So I would say that the rally that occurred here this weekend was different than maybe some other rallies that have occurred in the fact that they are flagrantly encouraging others to not follow public health advice, which is against the law, and they quite simply shouldn't do it. With respect to the individual that made some comments that were racist, and I think has been explained as that should be allowed due to the fact that we have freedom of speech in this country. Now, that's correct. We do have the freedom of speech. So then we also have the freedom for people like myself to describe those comments as racist, most certainly unnecessary. Those comments are foolish and they should never be made. And quite frankly, they're nothing short of idiotic. We have a public health, our chief medical health officer in this province who we should be very thankful to have. He didn't have to come to Saskatchewan. And he is among the very best providing the very best public health advice that any province could ask for. And many don't know this, but Dr. Shahab was trained at the University of Punjab in Pakistan, and he graduated at the very top of his class. He then received his master's in public health from the Johns Hopkins University, and he's a member of the Royal College of Physicians in the UK. He's a fellow in public health and preventative medicine of the Royal College of Physicians in Canada, and he completed his training here in Canada at the University of Alberta. He has extensive experience in the field of public health, and we're very fortunate to have him here in Saskatchewan. He could have chose anywhere in the world to go and practice his trade, but he didn't. He chose here. And Saskatchewan is certainly a better place because of the choice that he made. And Saskatchewan, I would put forward, as a better place because of the choice so many other people have made to make a community in this great province their home. So with respect to the comments that were made this weekend, I'm embarrassed. I'm actually very embarrassed that anyone from this province would make such disgusting comments. I find it sickening, and I know many other people in the province do. So I take the opportunity, and I want Dr. Shahab to know that we in government, and I know I would speak for a great many people across the province, we're so very grateful that he chose Saskatchewan, and we're so very grateful for all that you have done and for what you continue to do for the people that live here. And I would encourage people across the province that if you are also thankful for the efforts that Dr. Shahab has made, that you continue, and he continues to make for you and your family and your community, I would encourage you to reach out and say so, whether that's via social media, whether that's an email, whether it's just in conversations that you might have in your community. It's a Saskatchewan way for us to support one another, whether it's us dealing with an unexpected illness in a family or a friend, whether it's in the way that together we have come together to support one another in addressing this COVID-19 pandemic, or whether it's how we come together to support one another after some very disgusting comments were made like they were this past weekend. In this province, we always have and we will continue to support one another, and I would encourage you to continue to do so in the days ahead.
Follow-up, Murray?
Well, just to say my condolences and apologies to Dr. Shahab for having heard what he had to hear on the weekend. I would also like to ask that the Premier, you're getting criticized for maybe not coming down hard enough to a group because of political considerations, because of where they come from. There's certain elements of the group that do support your lockdowns or your opposition to lockdowns. Two things, I guess. At this particular point, do you regret having boxed yourself in the position of not being able to impose a full lockdown and a circuit breaker? And what do you say to those who say that you're not opposing or you're not willing to put forth a lockdown and the circuit breaker because it's not politically popular with a certain element?
So I would say that I am opposed to a circuit breaker or a massive lockdown here in the province for not the reasons that might be suggested. I don't believe it's the right thing to do. A circuit breaker or a lockdown, I mean, in saying that, it may be necessary at some point. If we are not able to continue to not only flatten these numbers like we have here recently as far as the rate of increase goes, but not continue to drive those down and to lessen some of the impacts on our healthcare system, it's not off the table or out of the question. The approach we have tried to take is one to slow things down to a degree where we can preserve the capacity of our healthcare system and where we can preserve the opportunity for people to go to work, to their job each and every day and to have a job, and preserve the opportunity for our students to go to school. And we truly believe that is the best place for our students to be, is in a classroom, to whatever degree possible, to be interacting with their friends as much as they can. So the reasons that I would be opposed to a lockdown, given that it may be necessary at some point, I don't believe that point is as of yet, are not political in nature. They are most certainly from my perspective, in the best interest of representing the people of this province, to ensuring that we not only have the opportunity to have life as normal as it possibly can be, but we have that opportunity to continue to go to work. We have that opportunity for our children to continue to go to school. We have that opportunity to carry on life as normal as we possibly can as we find our way to the finish line of this COVID pandemic.
We'll take our next question from the room. Mark?
In response to the Premier's comments, Dr. Shahab, what were your thoughts on the comments made over the weekend at the rally?
Well, I think racist comments speak more to the people making them than to whom they're directed. That's number one. Number two, I'll say I'm grateful to, obviously, the Premier, the Leader of the Opposition, many other people who reached out directly to me or spoke in the media, to condemn these comments. But I would like to say that, I have my own privileges. I'm a male physician, well paid with a good job, and I'm shielded from the harm that these comments make. But, we all know that there are many people in the province, in the world, who don't have these privileges and protections. So I think this gives us pause to think about our own prejudices, and all of us have them, I have them, and to be thoughtful about how we, what we say, how it impacts others. And I would like to say also that, people who think that these measures don't work or masks don't work, I think I would like to reach out and understand why they have that view. And I think it is important for them to consider the impact those actions have on their children who see this behavior, who themselves may then become in a situation where they will perpetuate these views. And also to see the impact they have on the surrounding communities, because I think this lack of empathy and consideration, the vast majority of people in Saskatchewan don't have this, but I think even a small number can tilt the balance towards an uncontrolled pandemic. And so that's about, not following public health guidelines, because we've seen how physical distancing mask use work. So that's about following the guideline piece. But around the, racist comments piece, I already said that, I think it speaks more to the people who make those comments. But I think we should always be conscious of the people who don't have the privileges, for example, someone like me has, and suffer great harm from some such actions.
You both talked about the plateauing of the daily case numbers, but we're still seeing high test positivity. How concerning is that, and how much is that leading to the measures that are being put in place now?
Yeah, so I think what we have seen, obviously, it's a cup half empty, half full. So on the one hand, as we looked at the modeling, 3 weeks ago, we're certainly not seeing, 400, 500 cases a day. And if we were to go in that direction, for example, if we were not careful over the holidays, we start going in that direction, then unfortunately, we would have to put in even more severe restrictive measures. And, circuit breaker lockdowns, they all relate to how restrictive the measures are. So that may still happen, because we have to remember this pandemic is not going to end till at least May, June, when hopefully we will have a greater proportion of the most vulnerable vaccinated. Summer will be here, and we'll start to come out of it. So this is not something that won't require, our constant attention till at least May. Sometimes being more restrictive, sometimes loosening up a bit, but that balance will have to continue at least till April, May. But in terms of our numbers, I've always said that we need to go down to less than 10 cases per 100,000. And, many provinces in winter in Canada, in the Northern Hemisphere, in Europe are struggling with that. You put in hard restrictions, you come down a bit, you loosen them, you go up right away. And that's why, what all of us do at home, at work, has an impact. And I think it's those little things. If you look at our case numbers in Saskatchewan, we aren't having super spreader events, but we are having small case numbers throughout Saskatchewan. And so there's no place where you can say, we've always said that doesn't matter, where you are, you have to be cautious. But right now, you have to be cautious to an, extreme level, so that you can't even meet friends and family, even 2 or 3 households at a time. In March, we could meet up to 10 people. We can't even do that outside of a household this year. That is how high the risk is. But on the other side, we're not seeing super spreader events, so some of the public health measures. And for long-term care, again, I think staff are working very hard there, but this is where we will all have to be extremely careful about not introducing COVID into long-term care facilities. So I think the levels of test positivity, cases of 100,000 are concerning, and we need to be extremely careful over the next 4 weeks, and we need to really see them coming down. We have an opportunity, over the holidays, once shopping is done, it's a slow time. Spend that with your immediate household, connect with friends and family virtually, and that will be an opportunity for us to maybe see it trending downwards.
We'll take our next question on the phone line.
We have Allison Bamford with Global.
Hi there. Premier Moe, you've said a number of times you were hopeful that the November 27th measures would allow us to have Christmas. Do you think that hope blinded you when making decisions? And had we enacted these new restrictions sooner, would we be in this position of canceling Christmas?
Well, I don't think my hope blinded me from any of the decisions that we have made throughout this pandemic. We've taken the advice that has been provided, worked with Dr. Shahab, throughout this pandemic. So we've, moved on the advice as we, as we've worked our way through this. If you look at the comparative graphs between the various provinces on, where measures were enacted and when they've been enacted in Saskatchewan, given that each province is a little bit different in their, in the sources of where their infections are happening. But there's still, a lot of work that happens between Dr. Shahab and I would also say between our ministers of health as well, where there is consultation, there is comparisons that goes on between the provinces. But ultimately, you have to look at where your infections are occurring, how they are occurring, and try to approach that in the most surgical way that ultimately you can. So. When you look at where Saskatchewan is today relative to where the modeling said we could be, we're doing very well. But yes, I was hopeful that we would be able to have, even for a couple of days, a little bit different Christmas environment, but we're not able to achieve that at this point in time.
Follow-up, Allison?
Yeah, I know next week obviously would be the start of Christmas break for schools, and in Regina here, both the Catholic and public school divisions have decided to switch online for this week and then the week following Christmas break. I'm just wondering why schools aren't at all included in these measures if they're going to be lasting at least until January 15th.
I would, I'll make maybe somewhat of a comment on that. Dr. Shahab, you may have a follow-up as well. And I understand there's decisions made last week in Regina, Catholic and public. I mean, they've been having some challenges with not just teachers that have, an availability of teachers that have been tested positive for COVID, but also a number of staff that have been asked to self-isolate, and they had a number of classrooms that did not have an educator in it last week, and have, through consultations with public health through the Ministry of Education. They have been in close contact throughout this as to what level they can operate at from the provincial level perspective, but then also how they can adapt their local divisional plans to ensure that they are taking the proper approach in their division. They've had access to Dr. Shahab as well as their local medical health officers across the province. I think Friday evening there was also a change that happened in Prince Albert with the Sask Rivers Public School Division and the Catholic School Division that is extending, I believe, the online learning for a week before Christmas and either 1 or 2 weeks after Christmas as well. I'm not sure if that's for similar reasons where they are challenged with their access to educators. It very well likely is. So the reason there aren't measures here for the education sector is that work is happening on an ongoing basis, not only weekly, but even on a daily basis in many respects with the individual divisions and the public health team, both provincially as well as the regional medical health officers. So that's work that will continue to happen on a very to some degree with provincial advice, but on a very localized with a very localized approach. And this is, I think, really the flexibility of the return to school plan that we had put in place shining. quite frankly. And this is a real tribute and a testament to the effort that is being made not only by our individual school divisions, but most particularly by the staff, the employees, the teachers, the educational assistants in the schools themselves. We have a fairly strong, very strong, I would say, record when it comes to controlling COVID in school-based environments, and that's on the people. That's a credit to the people that are working in those environments. It's a credit to the students and ultimately their parents. You want to speak a little bit more to maybe the discussions that have been happening on a more ongoing in a more ongoing way with the education sector, Doctor?
Yeah, thanks, Premier. So I would agree that I think schools have done extremely well. That even with high community transmission rates, they have just reflected community transmission and have not had large outbreaks. But having said that, with the large number of cases in both students and in some cases teachers and staff, it is disruptive to school operations sometimes. Sometimes many teachers are home either ill or isolating, same with students and their class fellows. And so for operational reasons, many school divisions have gone to remote learning or online learning in the last couple of weeks before the holidays, and may start a week or two later in January. But I would like to say that, with our high transmission numbers, we all know the drill. And in fact, it's interesting to see, just like Australia saw in their winter, which was our summer, we are seeing no influenza. So all the measures we're saying is keeping something that used to come like clockwork every year at bay. But COVID is more infectious than influenza, and it's not keeping COVID at bay. And here I'd just like to mention that, there has been significant challenges with contact tracing, and we need to help public health with contact tracing. And the way we can do that is keep our contact numbers low. And actually, just data I saw this morning is showing that our average contacts has come down from 8 to 5. So that's good. And, so our number of contacts are coming down. We need to bring them down further. If you develop a cough or a fever, there's 1 in 10 chance that your test will be positive for COVID. You may have other symptoms that may be due to other respiratory viruses, but there's nothing else much going around apart from COVID. And why that is important is you have fewer contacts to start with. As soon as you develop a fever or cough, get tested. Tell your family and co-workers who may have been a close contact. Let them know that you're going for a test. They may need to self-monitor. If you test positive, let your family and friends who you think you were closer than 15 minutes without a mask. Ideally, there should be no one outside your household that you should say, I was closer than 2 meters without a mask with this person for 15 minutes. But if there is anyone, let them know so that they can isolate and seek testing if they become symptomatic. We really have to make sure that our case contact investigations happen quickly through our own efforts and through public health supporting that where required. But then, in the new year, public health will continue to work again closely with schools so that they can start safely and maintain safe operations. But I think on our side, as much as we can keep our community transmission low, that helps schools to stay open. That helps to us to do other things that are essential, like retail, workplaces where you can't work from home functioning. And my final comment would be that I think as much as possible, staying home, going shopping in a systematic way, just one person from a household, and where you are able to work from home, continuing to work from home. These are all measures that will have a layered effect on bringing our case numbers down. Thank you.
I just, if I can pick up on one point there, and it's just referencing this morning I woke up and I was reading an article, it was from the Leader Post actually, from February the 5th of this year, speaking to the influenza outbreak that we had over in the last few months of last year and the first few months of 2020. And the numbers are somewhat struck me as approaching, I've had some people say that COVID is just another flu. And, here's some numbers for us to just keep in mind. Through last year's influenza outbreak where we had no measures in place relative to where we are today with COVID-19 and had a significant number of measures in place for some time, increasing some of those here today. Last year we had 2 waves of the flu, one in the late year, I understand, and correct me if I'm wrong, Doctor, and then one that affected our elderly more into January, February. We ended up with 1,334 confirmed cases of the flu. Now, understanding not everyone would send away for lab results for the flu that would ultimately have it, but many of our elderly and vulnerable would. We had 44 long-term care outbreaks with influenza last year. We resulted in total over 5 months, September, October, November, December, January, with 11 deaths. Where we are today with COVID is over 12,000 active cases, not 1,334. We have 91 deaths as of today, 89 as of yesterday, pardon me, 91 as of today. The most serious week we had with influenza outbreaks last year was 167 cases. I believe it was the end of January where we had that week of 167 additional cases. We are on a 7-day average today of about 260, 265. Almost 100 cases more than the most serious week we had with our influenza outbreak last year. Close to 10 times the death, about 9 times the fatalities. Over the course of 5 months, we had in our ICU department, in the intensive care department, due to influenza last year, 24 cases. We have 27 in there today, 124 in hospital. This is from my perspective, not being a physician, this is a much more serious virus for us to work our way through than even the influenza virus was last year when we had 2 waves of it come through our population.
We'll take our next question from the room. Adam?
Dr. Shahab and Premier Moe, what's the public health difference of me seeing my parents physically distanced inside a house versus seeing them without a mask at a restaurant? People are going to ask you why they can do one and not the other. So what's the rationale for that?
Yeah, so that does come up as a question. So again, what my recommendation is that if you are have underlying risk factors, especially if you're over 50 or over 65, without any underlying risk factors, you stay at home and order takeout. I don't think it is safe to be in a public place without a mask on. Which in a restaurant, if you go in with a mask on, you have to eat with your mask off. In other jurisdictions, where restaurants are open, you can only sit with your household. Here, at this point, you can go and sit with up to 4 people. But again, what we have seen, the evidence we have seen, is that in restaurants, there have been many outbreaks in the staff, like in the kitchen area. But there have been a few super spreader events in bars where public health protocols were not followed. But we have not seen high levels of transmission in restaurants per se. Having said that, if someone went to a restaurant while unwell, or even if they were asymptomatic and transmitting, and you sat at a table of 4, there is a risk of transmission. So I think we just need to be cautious that in any public setting, there is a risk of transmission. And so, especially if you have underlying risk factors, I think we all need to make that risk assessment, rely more on ordering takeout. I've said in the past that, if there was a retail area which used to have 100 cars at 5 p.m., it should really have 25 cars now. We need to slow things out, spread things out, go at times when there's less crowding. So restaurants have changed their guidelines, 3-meter separation now, only 4 people at a table. But there's still some residual risk. But the risk may be lower, like if you're sitting for an hour having a meal, than spending 4 or 5 hours in your home. I think there the risk remains high, and we continue to see transmission in those settings at a higher rate than in more structured environments.
I'd just say the numbers that Dr. Shahab had in his graph really will explain the answer to the question. Household exposures versus workplace exposures, and that includes staff and far greater than restaurants, is triple. Triple the cases have come from those household exposures than all workplace exposures put together. So this, the structure, there is risk, yes, in going to a restaurant, but the numbers would prove out that it is far less than hosting people in your own home. And I understand what the consequences of what I just said mean to families that want to have their grandparents in to see their grandkids, to see your parents in their own home. This is a Christmas unlike any other that we have been asked to participate in. But we need to ask Saskatchewan people to have that slower, to have that quieter Christmas, and to look for opportunities to do something maybe just a little bit different. I, for example, yesterday was home, and it was, I think, 26 below, maybe 35 with the wind chill, and took the opportunity to take my mask off and go outside and walk with my father at a distance, and pretty sure neither one of us got COVID in that weather because it would have froze the minute it left one of our mouths. It was very cold, but in fairness, it's, had we had other opportunities to see one another, we probably wouldn't have had that opportunity to go out and share a cold hour together, which we were very bundled up for. So you have to look for other opportunities, I think, to spend some time safely with your family members, and I just share that as one example. But it isn't lost on me. I know it isn't lost on Dr. Shahab, what we are asking the people of the province to do this Christmas.
Follow up, Adam?
You referenced the chart there that Dr. Shahab showed, and we have 1,300-ish cases either with pending or unknown exposure, 94 in a household setting. Some other places that have been restricted have fewer. What do we know about those, or can we presume anything into those numbers, which would give us a better sense of where they may be coming from? If not, are we flying a little bit blind in a way because we don't have all that info?
So again, I think there's a recent 2 or 3 weeks ago, public health staff made their best guess over the 10 top settings for transmission. And so whenever you don't have an outbreak, like 2 or more cases linked to an assessment, you can't really say where transmission happened. But we do know that for the most part, and even today, I was talking with my medical health officer colleagues, it seems that transmission is more, obviously if you're staying home all the time and not going out even for shopping, your risk is very low. If you're going out, this is what the investigations are showing. If you're just going out shopping, taking all the precautions, your risk is low. Your risk is higher, not just if you're going to work, but if you're interacting in a way, over break, after work with, colleagues, or otherwise interacting with people, where people do remember that, there was that time when I was closer than 2 meters, we didn't have our mask on, maybe we were sharing a smoke, or, other things that come naturally are still happening. And that is where transmission is happening. So again, it's not always the structured environments. Many workplaces have really good COVID protocols, but we're all human. And when we interact with friends, family, co-workers in a way that was very natural last year, that becomes the opportunity for COVID transmission. So I think that is the challenge. So it's not one specific sector, one specific utility. It is that very close, natural, human-to-human interactions that give COVID a chance. And that's why I'm saying, even over the holidays, we had to reimagine Christmas, stick to your household, greet each other virtually, or go for a walk while maintaining physical distance.
We'll take our last question on the phone line.
We have Britton Gray with CJME.
Yeah, I'm just wondering kind of what's the reasoning and rationale behind having retail stores kind of not have these new restrictions come in until December 25th when these next few weeks are going to be the busiest times of the year for some of them?
Well, I think the retail, the protocols, again, I think the protocols that are in place even now are not resulting in high levels of transmission. But it's not just the protocols, it's actually going at a time when it's less crowding. And many people have said that they have seen, there was a reach out to the retail sector through the business response team. They are as interested as customers are and as we are in keeping COVID transmission levels low, while enabling, retail, whether it's essential grocery items or, pre-Christmas continuing. So most people have commented that they've seen, protocols where, again, like we were in March, April, May, people are spread out more, they're more disciplined, everyone's wearing a mask. And I think that is going to be essential going forwards. But obviously, there is a slowdown after Christmas for 2 or 3 weeks, and hopefully, these extra measures will further dampen any residual transmission that's happening in those sectors. But again, I like to emphasize that with all these measures in place, the bulk of transmission right now throughout Saskatchewan, in small communities where there may not actually be a retail location, is happening through those small, through those person-to-person, social interactions. And I think that's where we all need to focus. You need to think through that with anyone who's a friend, family member, who's not in your household, we just need to, greet each other outdoors in a very different and safe manner.
And Britton, I just say that's actually a very good question. And I would just first say that this reducing the 50% capacity of your fire code isn't going to have a tremendous impact on, I would say, many businesses that are operating, although in those areas, those hours of the day when they may be extremely busy, what this will do is allow those folks to flatten out and maybe come at some different times of the day so that you don't have those particular times where you have too many people in your retail location relative to what the actual physical location can manage for physical distancing. I mean, this just speaks again to the fact that the measures that we had put in place have slowed the rate of increase of the COVID infections that we have. We do need to push that further, but this is again, it's a marathon, not a sprint. And we need to manage our COVID infections over the course of the next number of months, not just the next number of weeks. And we also want to keep things as normal as we can in our communities, not only in the short term, but in the longer term as well. So we feel this is Dr. Shahab and others have felt this is a measure that could be put in place that would help us yes, alleviate those times when some of our retail locations may be a little busier than they should be as far as the number of people in there, but also will just help slow things down over the course of the next number of weeks and just allow us to look at things a little different, not just through the holiday season, but over the course of the first half and into the middle for sure of this winter as we head into spring, but start to have access to these vaccines and start to really start to look at the finish line. So this is more of I think a strategic move and effort to, yes, keep things as normal as possible, but to start to really slow things down to stop that spread so that we don't have to face the question in January or February, and we're hopeful we won't have to face the question of a shutdown in our communities.
Follow-up, Britton?
Yeah, you have kind of answered this, and obviously now we have hindsight to look back on, but do you regret maybe not bringing in these restrictions earlier to maybe get closer to a normal Christmas?
I think hindsight on everything is always clear. Do I regret not making the decisions that we have made as a government in collaboration with Dr. Shahab? No, not at all. I think by and large, Saskatchewan has managed its way through this COVID pandemic in a very responsible fashion. And I credit the man sitting to my left, Dr. Shahab, with much of that. And the other people that deserve credit are the people of the province itself that had adhered to the advice that has been provided. Yes, we have seen numbers increase over the course of the last number of weeks or a couple of months now, but many other areas in North America have as well, and around the world. And we have managed that. We have responded to the increasing numbers in, I would say, a fairly ambitious manner. And I think if you look back to November 27th and where the modeling said we could be today versus where we are, that the November 27th measures have had a very large impact on curbing the rate of transmission growth that we've had in the province. Today's measures, and the measures that will be in effect until the middle of January, I think it is our hope that it'll start to drive that rate, not only level the rate of increase, but start to drive our active infection rate down. So, we're quite positive on the response. I'm quite positive on the response and quite confident in the response that Saskatchewan has had. Again, I thank Dr. Shahab for his guidance, but most importantly, I thank the people of the province for what they have done to ensure that we are able to be in a position where, when you look at Western Canada, we have as much of our economy, as much of our communities open as any other place in Western Canada, and not far away from being as open as anywhere in Canada. And we are able to continue to preserve our healthcare capacity. We're able to preserve jobs in our community and ultimately preserve our opportunity to recover when we find our way through this.
Thanks for joining us today, everyone. That concludes our time.